Last spring, Katie went into a hospital to give birth to her second child. She came out with a very real fear that her newborn could be taken away, all because of the results of one urine drug test.
I didn't even take any over-the-counter medicine. I didn't take Tylenol, so I had nothing to hide.
But later, a nurse came in with startling news.
She told me that my drug screen tested positive for opioids.
Katie says the test results didn't make sense, but that day before coming to the hospital, she did have an everything bagel, and that bagel contained poppy seeds. But the hospital still reported Katie's presumptive positive drug test to Alabama child welfare officials. And just hours after Katie gave birth, a state social worker came to her room and asked her to sign a safety plan.
I asked her what would happen if I did not sign that safety plan, and she said they would be taking both children right then.
Urine drug tests are notoriously unreliable, with false positives as high as 50%.
Let's also be clear, one positive urine toxicology does not equal a substance use disorder. All it says is this person was exposed to something that made this test positive.
And not necessarily drugs.
Hello, as is the case of this everything bagel, which probably had poppy seeds, which often can be a false positive for opiates. That's entirely unfair.
What happened to Katie isn't new. We've had several cases that go like this. Healthcare providers drug test and screen a pregnant person or their newborn without their consent and then report a positive result to family policing agencies without even telling the patient sometimes. This violates bodily autonomy, can lead to forced separation of families, and almost never leads to any real connection to care or treatment. It also breaks trust between patients and providers, which keeps people from getting care. Hospitals also report pregnant people even if they test positive for medication given to them by the hospital during labor. For a month, Katie was only allowed supervised time with her children, and she had to leave her house at night even though she was breastfeeding. Others have their newborns taken from them right after they give birth. Our research has found that most people face pregnancy-related criminal charges because of alleged substance use. Unless informed consent is required, more women and families will be torn apart, fed into the foster system, and faced with unnecessary trauma instead of being given support and care. A drug test does not equal abuse or neglect. It's not a parenting test.